Hey everyone, it's a dose of Dr. Drew.
Here we are. Yes, indeed. Yes, thanks, Jason. Thumbs up. Let's get everybody in here. Oh, Julie in the UK. Hi there. Where in the UK are you, Julie? Interested to know. We're gonna do. Yes, that was a faceplant, but that was only my. I believe that was my very first time up on a wakeboard. It was definitely the first time I had attempted to be up. I think the first couple times I fell right away, and then that was the only time standing up. And of course, Susan has to share that with you all, which is lovely. She thinks that's funny. How long until you can't see antibodies in the body anymore from the virus? Mark's asking, and we don't know the answer to that. There's fear that it falls off within 4 to 6 months. The problem is we don't know if that equates with immunity or not. The T cell story has yet to be told, so stand by on that. I can tell you that for the vaccines, they're seeing 2 to 3 times the number of antibodies as compared to somebody who's had the virus. And Ashley's thanking you, Susan, for sharing that. She thinks it's funny too. Gianna is in Texas. I'm sure that's way better than Los Angeles. There will be many of your compatriots down there. I just heard Joe Rogan talking about that, and he's out. He's done. And there are a lot of Californians are done because it's a shit show, California, and Los Angeles even more so. It is disgusting, the leadership, lack of leadership, in particular in Southern California. But there we are. I'm in New York today, which is a ghost town. It's a very interesting. I think I mentioned this last couple of days. Joan, I'll maybe give you some good news. Is that this pandemic is different in every state you go to. It's like a different phenomenon. In California, people are kind of going about their lives, but the government is lauding over the populace like unbelievable compared to other states. Georgia, they've got a problem there. They have difficulty getting people to wear their masks. Life is sort of on there, particularly out in rural Georgia. They barely know there's a pandemic. Here in New York City, which is fascinating, the government is encouraging people to come back and to open businesses, I think, and people are too afraid to do it. This is why we're going to go down to the meatpacking this evening and see what it looks like. But generally, it's hard to find open restaurants. It's hard to find food. It's crazy. And the street is a ghost town, which is very weird for New York City.
Well, what's weird is you can get a reservation the same day.
Yeah, get reservations right away because the things that are open, there's nobody here to fill the restaurants. Jeremy, Leo Terrell's new podcast. He's going hard AF. Yeah, Leo is very upset with Kamala Harris, I guess we say it. And that's really interesting. Hit the Upper East Side, Lewis says, there's lots of outdoor dining. That's good to know. But the point is, there's nobody there. There's nobody in the restaurants. It's like you sit in restaurants by yourself. Yeah, it's very weird.
It's like locals would here in New York.
Yeah, it's very strange. And so the point being, I was comparing Georgia and California and New York. In New York, people are wearing their mask religiously. They're just not even coming back. They're not doing anything. They're just staying inside or they've left. And they're sort of being encouraged by their government to get back to things. And no one's doing it. It's why when there was demonstrations here, there was no transmission because they wore their masks. I guarantee you that. What is the death rate? Wait, where'd you go? What is the death rate now, though age hasn't changed? Okay, Mark. Death rate is down markedly everywhere. It's turned downward in areas where there have been surges. And hospitalization is down dramatically, and it's falling rather precipitously. So I feel like we may see a really significant drop in the next couple of weeks. Reason being, the treatments are vastly superior. People are staying out of the hospital. People that go to the hospital aren't going to the ICU. People going to the ICU aren't going on ventilators. So we're doing a much better job of treating this thing. And within the next month, we're going to have a bunch of things like leronlimab, you've heard me talk about here, things that block the cytokine storm and to make a significant difference in the outcome. But as it is, we have Decadron, we have convalescent plasma, we have remdesivir, we have a lot of things now that make it very, very different than it was at the beginning. So we can treat it quite effectively. And yes, younger people are getting it also, and the younger folks are less likely to get seriously ill and less likely to get serious complications by a large margin. I've said this repeatedly that when I got prostate cancer and had my prostate out, they told me I had a 90% probability of cure. In medicine, that's like saying 100%. Now, with COVID, you have a 99% probability of recovering. I mean, that's way on your side if you're a young person. If you're an older person, it's 85 to 90%, which is like me with prostate cancer. I consider myself cured. That risk is very low. On the other hand, locking down, taking people's lives away from them, if you're 80 years old and they're taking a year of your life away, that may be 20% of all you've got remaining for a risk of 10% if you catch this thing. It's a major thing. And here's what you need to know. Angelina Jolie wrote an article today in the Los Angeles Times talking about the untoward and long-term consequences on the health of children. 10 million children are estimated to be the object of domestic violence, or at least in the presence of domestic violence. And she's right. None of that is being detected now. The schools are the predominant way that is detected. The social service visits are way down. And now this from SAMHSA. SAMHSA is the Substance Abuse Mental Health Services Administration from the government. The CDC put out data today. Let me read you some of this data. They put out a study from late June, and I posit that things are even worse now, that showed anxiety disorder was 3 times that reported in 2019, depressive disorders 4 times the second quarter of 2019. 24% of Americans are reporting depressive. They meet criteria for a depressive disorder. This is profound. Suicide up. Substance up. I'll give you some more data here. This is just out of the CDC this morning. This is worse in terms of impact on people's lives than COVID. You've got to understand this. 31% reported anxiety and depression, 26% reported trauma experience, 13% started or increased substance abuse, 11% seriously considered suicide. 11% of the population. Think about that. These are massive, massive numbers. And SAMHSA came out today, the Assistant Secretary for Mental Health and Substance Use, Dr. Eleanor McCants-Katz, warned the emergence of increased mental health and substance use issues since the start of the pandemic. They've been chanting about it, as have I. And the negative health effects are potentially long-lasting and very consequential, and for families. They go on to say the MMWR, which is the report I just read to you, clearly evidenced the issues caused by social isolations and lockdown, but they failed to report key strategies for addressing this. Yeah, well, here's what the Mental Health Services Administration, the Substance Abuse Mental Health Services Administration for the federal government says their recommendation is, listen to this, safely reopening the states and communities. This will facilitate the improvement in mental health across our nation. Open up. That's our only option to deal with this isolation and this catastrophe. And that is taking into account, I'm sure, some of the economic effects. So this is really, really, really serious. Here is SAMHSA, which is, a limb of the federal government. It's a mental health organization. They are saying very clearly, we cannot continue to ignore the health consequences for all other conditions in favor of singularly focusing on the virus containment. Have you not heard me say this for 3 months? This is the part that when I got myself in trouble by screaming about the panic porn. This is how I got myself in trouble. I knew this would happen. I knew this was coming. And here we are now with a more profound effect on the mental health than even the death rate of the virus itself. Capiche? You get it? You see what's happening here? And our leaders have their heads in the sand. They are doing nothing to address this. Nothing. Julie, who's in the UK, tell us that mental health stuff is up in the UK, but your health services are addressing it and have been, it seems to me, from the beginning. You're not getting the vaccine, Boyd. Good luck for you. I'm getting it as fast as I can get it. And which vaccine I get, I've signed up for the phase 3 trials. I can't get it fast enough. What are my thoughts, Dustin, on the phase 3 trial, skipping the phase 3 trials in Russia? Yeah, it shows you that you can skip safety requirements and you can get something to market very quickly. If you don't care about the safety and efficacy, you can bring stuff up in a few weeks. But I wouldn't take that one. This is the point. In terms of Boyd, who was saying he doesn't want the vaccine. So much safety and so much efficacy material is investigated. It's insane in this country. And that's why I proceed. Bring me into the third phase. I'm fine. Anyway, folks not seeing the loved ones. You're saying Monica, I'm not sure what I'm missing. That's what I'm saying is the cause of all this. I agree with you completely. No, we don't have disease spreading faster than anywhere else. No, we don't. We're learning to live with this disease here. Other places have tamped it down. As soon as you tamp it down, it comes up. It clearly is not something you can eradicate. COVID in jails, yeah. That's a serious problem in jails, but in Southern California, they just released everybody. That's what they've done. So we'll see how that works out. Mary misses hugging. I can understand that. Suicide up, domestic violence up, child abuse up, substance abuse up, depression up. People aren't taking care of their other health issues. And hospitals are filled now with people that have delayed getting their medical care. I just talked to somebody a few minutes ago who broke their face open in a fall and was refusing to go to the hospital for fear of COVID. You're not going to get COVID in the hospital. It's not going to happen. Go to the hospital if you have medical problems or injuries. You can't do that. Okay, how can there be a reliable vaccine when where'd you go? Oh, I lost you. It's just moving kind of quickly here. I'm sorry. Why don't they put masks on the inmates? Interesting question. How can there be a reliable vaccine when the yearly flu shot is only partially effective? Dean, influenza virus is very different than coronavirus. The targets of the vaccine with influenza virus change every season. We anticipate what those changes are. We can't perfectly predict them. Coronavirus has fixed spike proteins that never change. They're necessary for the virus to get into the body. So those spike proteins are perfect targets for a vaccine because they never change. Now, how long will the immunity be from a single vaccine? We don't know yet. That's got to be addressed. Is it something we'll have to take every year? Possibly. But influenza and coronavirus are very different organisms. Quercetin have heart arrhythmia complications as hydroxychloroquine. Ashley, hydroxychloroquine does not cause cardiac arrhythmias. I've been using hydroxychloroquine for 35 years. In fact, I mentioned this yesterday. I was just doing one of my continuing medical education exams, which I do on a regular basis, and I was doing rheumatology. Hydroxychloroquine, first-line drug for rheumatoid arthritis and lupus, and they recommended continuing it during pregnancy. They said it's so safe that you can give it during a pregnancy. I don't allow pregnant women to take anything, not even Tylenol. But apparently hydroxychloroquine, as I've said, is safer than Tylenol. So there you go. And the quercetin, I don't know of it causing any significant side effects. So. Are California cases dropping? Absolutely. Well, the case number has gone up because there was a backlog. If you notice, the head of the health administration of the state of California lost her job because she had some sort of error in the laboratory reporting of the number of cases. So there's a backlog coming in right now. What it does, it just changes the slope of the decline in cases, right? So we had a very steep slope of decline. And all of a sudden, we had a couple of cases that came through. It essentially just makes the slope do this. It's not that big a deal. Hospitalization, death rates dropping dramatically and have been dropping. Right now, in Los Angeles County, and we don't even have updated data yet, but as of about 10 days ago, the hospitalization rate and death rate was the same as it was in May. So way down before the surge. Yes, Alyssa, absolutely. I don't know what the hell is wrong with our mayor that he does not bring his little magic dial back to yellow. It could have been an orange back in June, and then it should have quickly moved back to yellow because people are doing their thing. Again, very arbitrary, some of the closures, why the salons and nail salons are closed. That's ridiculous. Connie, I'm not sure what you're asking about the airborne. It is, of course, an airborne illness. It's not as bad as measles. For instance, measles, if somebody with measles coughs in a grocery store, that aerosolized virus will sit there for hours and infect dozens of people. Anyone who walks through will get infected if they're not properly vaccinated. That's measles. Measles has a 15% mortality rate, last time I checked. That's what? For a young person, 100 times more deadly than coronavirus, or 1,000 times more deadly than coronavirus, and yet people are wondering should they get their vaccines. I mean, think about it. I don't know why you can't find anti-abuse, Nick. The test, I had I had another coronavirus test yesterday. The one that's way up in the nasopharynx is a little uncomfortable. That's the one that's on a video. The one I had yesterday was more in the front of the nasopharynx. It's a little different technique and a different technology. Was not uncomfortable at all. Do I think masks are really effective? Categorically, I think masks are effective. I think the masks are the reason the virus is going down right now. Now, we don't have a lot of great, placebo-controlled crossover studies to prove that, but we have the MIT study, which showed that the droplets are prevented, that we know the virus is carried upon, and we have had mask mandates in states where we can argue about the mask mandates and the data and stuff, but the fact is, once people start wearing masks, things plateau and turn downward. Now, is that social distancing more than mask wearing? I don't know. These are all viable questions. But it's pretty clear that when both people wear a mask, the transmission is from nose to nose. The problem I see with mask wearing is people wear it here, and that is not mask wearing. That is leaving the passage of transmission wide open. Yes, Lewis, gyms are open here in New York City. I'm going to the gym here. And again, this outbreak is completely different wherever you go and how the governments deal with it. You see how capricious and arbitrary it is. It's ridiculous. Kellyanne, such a lockdown is unnecessary. The lockdown in Southern California is, again, capricious, unnecessary. It's government overreach. You should fight back. I've been in Georgia. I've been in New York City. There's nothing to suggest that somehow it's needed in Southern California. It's just not necessary. Paul, I'm reading your thing here. All right. Well, Paul, as I said, I'm going to get in any phase 3 trial that I can enroll in. I'll be happily enrolled in. The vaccine technology is unbelievable, and it's exceptionally effective. And this is going to lead to more vaccines too, which will prevent more illness. Let's remind ourselves. I was here 20 years ago talking about the Hpv vaccine, which has prevented thousands of cases of cancer. And people were pushing back on that one. It now has the best safety profile of any vaccine in history, and prevents worldwide hundreds of thousands of cases of cancer. And if you don't think you can get it, look at all the rise in head and neck cancer that's going on right now. Michael Douglas has head and neck cancer from HPV. It's very, very common. Have I spoken to Dr. Zelenko? I've heard reports. I've had a little Twitter action with him, and he's doing fine. He's doing fine, I keep hearing. Kimberly, the Georgia numbers are mostly about Atlanta. In Atlanta, the behavior was sketchy. I was not super happy with the behavior. It made me nervous. Bars are kind of open, or at least bars that serve food, and people are a little bit cozy there. And out on the streets, I noticed people were not wearing their masks, and if they were wearing it, they're wearing it below their nose. And at the airport, that's not true, Mysterioso. That is not true. Check your worldwide data on the incidence of adverse effects from the Hpv vaccine versus the number of cancer deaths prevented. You've got to be able to think statistically. Our brain won't think statistically for us. You have to train yourself to think statistically, because your brain goes, oh, somebody got hurt, that's it, I'm not going to do it. You don't think about the 100,000 cases that were prevented. Be that as it may, in Georgia, in Atlanta airport, it was, let's put it this way, I'm glad I got my COVID retested, because I felt like there was potential exposure there. It was really not good. So I would say Georgia is not behaving itself, even though their data is not that bad. I mean, they're in an outbreak, and they're sort of plateauing. Let me actually look it up for you, so I'm not just speaking anecdotally. Let me actually get the data. I'm sorry. Oh, where is it? Where is the data? I'm sorry here. It's not coming up. I wonder if I threw that one away. It seems weird for me. I don't think I would. I don't see it. So let me find, the COVID tracking is the best place to look at that. Okay, here's their data. We're going to go down to Georgia really quickly. I'm sort of done with the University of Washington stuff, as Andrew Ashkasvili is too, because it's so outdated by the time they put the data up. It's hard to say anything about it. And they're highly speculative graphs. Oh yeah, okay, so Georgia's in a downturn. Their cases are sort of down and plateaued. Hospitalizations are down, death rate is plateauing. But their case rate, they were at less than 1,000 cases per day, and now they're over 3,000 cases per day. And so they really need to get it under control, and it's not going to get under control easily with the way people are behaving out there. But that's up to the great people of Georgia. Their government is sort of letting them muddle through this on their own. Do I think the president will advocate vaccine to be pushed by November sooner? Alyssa, I do think he's going to try to push through a vaccine sooner than November. I do. The Russia vaccine I would not take. It has not been through proper studies yet. Alicia, they're allowing 50% efficacy for the COVID vaccine. That's not true. Because you're going to see close to 90% efficacy of the vaccine, and those are the ones that are going to come to market first. Now, there will be other vaccines that are not as effective, that are cheap, that will be made available to the world. That's part of the process here, is to get the world vaccinated. But believe me, in this litigious country of ours, it is going to be highly effective, highly safe vaccines only. How long will we live in fear of COVID, Nancy Jane asks? Until we get properly vaccinated, I don't see how we get out of this. It's going to be like here in New York, they're saying that it'll be 2021 before people get back into the city, which is really crazy. I mean, it is a ghost town here. I am using my UV wand. It's kind of within reach here. Let me go get it. Hold on a second. People argue about whether this is adequate, but I have been using it for sure. The UV light wand, I run it for 20 seconds over everything. Like if this is the computer screen on the plane, I just run it 20 seconds. The data, I've read the data, it's pretty good. I also use Clorox on everything. Here's Brian says, Biden wants a national mandate for masks. I don't think that's a good idea. Because if you live in Montana or Idaho, you don't have virus. You don't need to wear a mask. Like I said, I was in the outback in Georgia. There were 0 cases in the county I was in. You don't need to wear a mask. So to have a national mandate does not make sense. Now, to have a statewide mandate, I don't even think that makes sense, frankly. I think counties should be making the mandates. Right now in LA County, it's a mess in terms of incidence of the disease. In Ventura County, there's almost nothing. So if Ventura wanted to lighten up, they should. I still think if you want to really tamp it down as much as possible, everyone should be wearing masks. But that should be county by county, which is kind of how we've been doing it in this country. It sort of seemed to be more state by state. Do I think people become dependent on wearing a mask to feel safe even after all clear? I do think we will see a lot of mask wearing that we've never seen before. I will be tempted to wear a mask during influenza outbreaks and upper respiratory outbreaks, things like that. I think we will surpass Asian countries. Here's a prediction. I think we will surpass Asian countries in terms of our mask wearing. And as I was saying, how different the epidemic is wherever you go. Here in New York, this is all fear-driven. People are scared crapless here. You can see it on their face. You get near somebody, they won't get near you. They won't talk to you in an elevator or any outside. I mean, it really is a fear-based phenomenon here. So the government's actually encouraging people to come and go out. They're not willing to do it. People are isolating still here. Why do I use Clorox and UV light? Good question, Dustin. To reduce the risk of transmission through hands and face, I don't think that's a predominant way. Here's the way I think about it. Washing hands, Clorox, UV light, all that stuff reduces the potential for hand transmission, even though we don't think that's much of the means whereby it's transmitted. When I'm out traveling, touching lots of things, I feel like in an airplane which had lots of people in it for long periods of time, I'm sort of hedging my bet. But thank you, that's a good question, because the predominant means of transmission is respiratory. 17 feet away in a gym, that is kind of crazy. He works in a gym, but they at least allow you to open. At least they're allowing you to function. Do I use Clorox on? No, I use Clorox on every surface in an airplane. At home, Susan has always used Clorox on stuff because that's the best means of controlling viruses. I interviewed Dr. Victory and discussed the article in the New England Journal, which explained why children were less susceptible. Do you remember which article? I don't offhand, but I believe it was the article that showed they don't actually have the ACE2 receptor site, which is where the COVID virus binds. I did report on my Fox 11 program last night on a new nano product that, remember I mentioned the spike protein? Well, the spike proteins have little receptor sites on the top of the spike. They are now inventing nanoproteins that will block that spike receptor so it can't bind with the ACE2 receptor site. It's going to be a nasal spray. It's going to be really good. I think that's going to be rushed to market in the next month. And my expectation is, because most colds are coronaviruses, That may be the cure or the prevention for the common cold. That'll be very interesting. Yeah, Connie, you said something about Biden's gait. His gait actually looked better to me yesterday when he was walking around with Kamala Harris. He was swinging his arms more freely, and his gait looked a little better. So that is good news for him from a neurological standpoint. Why so much Okay, Lori. Why so much contradictory information from medical professional on what works and what doesn't? That's how medicine works. We go forward in fits and starts. We read the literature. We as doctors are trained to study the literature and then make the best decision for our patients. It takes years for things to become clinical axioms, they become sort of clinical pathways. But before that, all doctors have is the latest research, which can be very conflicting, and the clinical circumstance of their patient, where they're trying to apply the best practice for that patient. We do this all the time, which is why at the beginning of this outbreak, I was saying, get the press out of this. You just learn how to pronounce hydroxychloroquine, and you have an opinion about it? That's insane. That is truly insane. Let the medical system work these things through. This is how we work. This is how we do things. So it's not conflicting information. It's much like with diet. People go, oh, the lipids are good, lipids are bad. What are we supposed to do with our diet? That's how medical science works. It takes long periods of time to work through complex issues. Okay, it's biology. Biology is infinitely complex, infinitely complex. Okay, let's see here. Get rid of the common cold, wouldn't that be nice? Somebody's saying. Did I see Trump at yesterday's briefing? I did not, Shauna. I did not see the interview with Fauci. I'm sorry, Jean. Can I talk about asymptomatic spread? Asymptomatic spread is one of our greatest concerns right now, right? I mean, community spread is the issue. But let's remind ourselves, I opened by talking about the SAMHSA data that's showing how profound the mental health data is now. It is profound. We are in a mental health crisis with substance and suicide, depression. 24% of people reporting measurable depressive disorders. That is profound. We have to pay attention to that as much as we're paying attention to the COVID. So that's got to happen. That's got to happen. Yeah, the good pyramid did make Americans fat. That is true. Look at some of the interviews I've done on the stream. If you go to YouTube or Facebook with Kate Shanahan, we talk. And also I've got a podcast coming out you can find on my website with, Paul Saladino about lipids and how complicated that all gets. But you'll see that if you avoid bad lipids and avoid carbohydrates, you're kind of moving in the right direction. Suicide can be prevented, Joshua. That's true. Kevin, congratulations off alcohol. Suboxone, substitute one. Yeah. Okay. So that is Mark, I believe. Yeah, Mark, I share your concern that substituting one opiate for another is a kind of insanity, but there are some people who are going to die of their opiate addiction if we don't find an opiate that has a pharmacology or the relationship with the opiate is different than the relationship with some of the shorter acting opiates. So in certain cases, Suboxone can save lives. But I agree with you, as a general principle, substituting one opiate for another is kind of silly, and by the way, the medical profession has been looking for that holy grail for 100 years, and they will never find it. Thoughts on homeless and COVID? Brian, most of the homeless actually don't have COVID, probably because they already sort of have a social distancing in place and they stay out of doors. Quarantine 15 is real. I don't know what that is, Lewis. 100,000 infections in children. Dustin, do not confuse infection or carriers with infection. Children do not get sick from this. So even though they have the virus, doesn't mean they have the illness. But it is believed they might be able to transmit, though. They're much like the same concern we have for veterinary transmission, right? They can get colonization, but they don't seem to get sick, but they might be able to transmit. Do I think if people continue to measure the mask and distancing, the fall will not be as horrible? Yes, I think if you get your flu vaccine, you must get your flu vaccine, and we must keep wearing our masks. I think the fall will be not so bad. I really do. Gabriel, I don't know what you're talking about, the New England Journal. I read it every week, so I hope I've seen that study, whatever you're referring to. Saturated fat's more to blame for insulin resistance than carbs. Ramey, that may be true, and there's several doctors good researchers that do go into that, do sort of would believe that. It's really the behavior of our adipose cells, and how our adipose cells are saturated with these bad fats may affect insulin resistance and really be the issue. Marijuana helped me off the booze. Good for you, Kevin. That's good. Why is California homelessness so bad? It is so bad because we made drug use and drug trafficking and stealing to support your drug habit legal in California. So I know drug addicts. They're my people. They're my patients. I've worked with them for 35 years. And if you tell my patients that they can use without consequence, and steal to use, they are coming to your state. That's why we have so many there. We are open air, shooting galleries, and asylum. That's it. Oh, quarantine 15 pounds. Is the flu vaccine out yet? No, it is not, but it should be out in a couple of weeks, well, about a month. Does buprenorphine block opiates? Yes, it does, because it's an opiate itself, and it binds at the opioid receptor site with a somewhat greater affinity than some of the other opiates. Thank you, Jason. Okay, I've been talking for about 35 minutes. I want to keep things kind of short today. Kratom is a natural opiate. Yes, that is true, Mary. But an opiate is an opiate is an opiate. Pure and simple. Anything that binds on those endorphin sites and causes the stimulation of the euphoria system can, in genetically prone individuals, cause addiction. Period. End of story. Full stop, as they say. Search for mRNA vaccine against SARS. Yeah, I read that article, Iva and Gabriel. I saw that article. It was a good one. It was an early one. It was not one of the more recent. Again, it takes a while for things to be published in the New England Journal. They have the peer review process, the editorial process. That was about the phase 1 trial. We're already into phase 3 with that same vaccine. Home here right now. Thank you, Kaylee Pie, backyard. How is Shelly doing? Shelly's doing great, Bunny Bubs. Her program got shut down, so I don't know what she's doing to fill her time. We are going to bring her on here to one of the streams soon. How are my workouts? Mandy, finding that running has been very important in maintaining my mood issues, staving off the depression, anxiety that we're all experiencing. I went running yesterday by the Hudson River, and it helped me a lot. I've been managing to lift weights most days, but I've got such bad shoulder problems now that I can't do what I want to do. Why are the deaths per 100,000 higher than places like Brazil and Mexico? Don't we have much better health care in these countries? Deaths per 100,000 or cases per 100,000, Todd? And let's remind ourselves that, I don't know, check that data. I think you're looking at cases per 100,000. Prescribed stimulants, but they weren't working, so you took more. That is not good. Taking more of anything that you were prescribed is going to end up in trouble. Jake, here's the problem with the kratom as a pre-workout. Opiates, if you're not prone for drug addiction, opiates should make you sleepy. Drug addicts want to go do stuff when they get exposed to opiates. Non-addicts get sleepy. So if you're taking kratom and it makes you go up, I would be very, very cautious about that. Are people in New York City better at wearing masks than California? Selena, yeah, they are, because they're scared shitless here. They're just doing everything. They're not even here. They're just leaving, and they're not going out, and they're not doing anything. The behavior here is totally different than everywhere else. Andrew, I can't even think why we would use the IHME models anymore. 8 days since last update. Yeah, they're updating like every 10 to 12 days, and the COVID tracking project updates a couple times a day, it seems like, at least every day. And so, yeah, go. I just use that data. It's much more updated. It's much more relevant to what's happening today. Somebody's asking if I'm in favor of creatine. Yes, I do use creatine. Yes, I do.
My computer's.
What's the matter? Oh, you're going out of...
Batteries right now.
Batteries are dead. That would not be good. That would shut us all down. Can alcohol affect the vagus nerve? Mysterioso, I'm sure it can, but it's more that alcohol, if you have a vagus nerve regulation issue, I would refer you to Stephen Porges' material about the vagal theory. That's more about trauma and trauma therapy rather than worrying about what alcohol does or does not do. When do I suspect the virus will go away? I think it may be with us for a few years, but it will be at such a low boil. If we get properly vaccinated, it won't be relevant. Is Mrs. P coming to dinner tonight? Yes, she is. She's getting ready. She's stepped away from the driver's seat here. You've noticed she hasn't been yelling into the mic. Am I CIA? No, I'm not in the CIA. Oh my goodness, I'm getting lots of text though. How quickly can anemia resolve after starting iron supplements? It's pretty quick if you're absorbing the iron, like a month. You should see improvement immediately, very quickly. But the big question is, if you have iron deficiency anemia, why do you have iron deficiency? Where are you losing the blood? And is it from your colon? Because that's the most serious place people lose blood that can cause, again, if you have a cancer or a polyp or something, that's where people lose blood. Will you take the vaccine? Leanne, yeah, I've said repeatedly, not only will I take the vaccine, I want to be part of the phase 3 trials. I can't get the vaccine fast enough. They clearly are efficacious. They clearly are safe. The technologies are phenomenal. The biotech on this is phenomenal. I want it right now, and I will happily sign up for a phase 3 trial. You were diagnosed with diverticulitis. Yes, Claudia, I have that too. We'll need a colonoscopy soon. Yes, you will. Seeds and nuts can cause flare-up in some people. Popcorn also. Okay, so Dustin, I have friends act completely different after prolonged drug use, almost like they aren't the same. Yeah, rapid speaking, sketchy. You're talking about meth, all right? And with meth, people do have a persistent hypomanic syndrome that can last for months. That's one of the horrible things about meth. So that should be treated. You can actually treat that with medication. Therapeutics versus vaccine, Ashad? Both. Therapeutics are exploding right now. Next month, you'll hear about a lot of this stuff, or you'll see it clinically being used a lot by doctors. And the vaccine, I'm going to predict the first vaccine is going to be out in late October. Andrew Ashkazvili, I would love to move out of California. I am desperate to do so, but I have so much entanglements there, I don't see how I possibly could.
And we like our house.
We like our home, we like our house, even though it's going to be worth dust in no time because people are going to stampede out of California.
No, it's not.
And so, you know.
Not our house.
Thank you, Lindsay. We've been at this for a while, Lindsay. I'm only going to be doing about 10 more minutes or so I apologize. You're just getting here. Stephanie, I'm sick of worrying I'll get the virus too. Children in daycare, coming home to adults or grandparents. Yes, of course, that's a serious issue and a worry, and kids should be wearing masks and distancing and doing as best we can to reduce the transmission. And, there's going to be some transmission when we open the schools. But again, I opened this conversation by talking about the SAMHSA data and the CDC data on our healthcare, our mental health care, and our mental health condition in this country, and the LA Times article by Angelina Jolie about the profound effect on children. We have to begin paying attention. Every time there is a pharmacological or non-pharmacological intervention for a disease, it has untoward effect. It's going to affect other things. That's the way medicine works. Every time a doctor does anything, there will be some sort of side effect, some sort of risk benefit where they've gone headlong in one direction without considering the potential risks in other areas of people's medical and mental health functioning. And now we're having consequences where the death rate from mental health substance use is going to rival COVID. That's where our emphasis needs to be going forward. And SAMHSA, who is not exactly it's kind of a conservative part of the federal government, the Substance Abuse and Mental Health Services Administration, are saying the only solution to our mental health concerns is to open up. That's SAMHSA saying that. RMA vaccines. Let's see, I'm trying to read what you guys are saying. Rather be broke in California than rich in Georgia. I don't know, people have pretty good lives in Georgia. No, I'm not going to be on Alex Jones. Sorry. Do I wear a mask when I run outside? Absolutely, I do. I understand. I will pull it down when I'm not around people, but I do it out of a courtesy to anybody because I'm breathing very hard, and I don't want to transmit. If I happen to have this thing, I don't want to transmit it to anybody. Chrissy, congratulations on your 19 months of sobriety. Surf turnarounds. Yeah, dude, you're a surfer. It's hard to maybe you could live in Baja as opposed to San Diego. Hashtag save the children. Okay. We have no tolerance for risk anymore. We need grit. Monica, you are correct as always. Monica Riki's on there. Hi, Monica. And when did we start hiding from things as opposed to fighting them? That's my question. When did we start hiding from difficult opponents as opposed to fighting it? We have to fight it. We have to live with it, and we have to fight it, and we have to fight actively. Yes, Caton Moreno. Yes, that is the way to fight the mental health issue. Beach is great. I'm sure it is. Jay's philosophy. Yeah, Eva, Harvard's Michael Mina's proposition using cheap rapid result tests. I think that's coming. I think we're going to see a lot of that in the home, where stuff is mailed into the home, and we have these sort of not exactly accurate but cheap and rapid tests. I think that's coming. Am I going to be on YMH Live tonight? No, I don't think, unless they call me. They have a way of calling me all the time. What is YMH? It's Your Mom's House. It's a platform that I'm on with Christina P. and Tom Segura. My particular show, my own show on that platform is called Dr. Drew After Dark. Please check it out. You can see it either at Your Mom's House or at drdrew.com. Nancy, you're on 20 hydroxycodone a day and you want to try Suboxone. Yeah, you should use it as a detox protocol only, okay? Try not to use it as something you stay on, and start going to meetings immediately and get a therapist, get a mental health professional who knows how to treat opiate addiction. Is transmission from child to adult less common than adult to adult? I don't actually know the answer to that. Will we ever see another celeb rehab on TV again? Gail, I just saw Leif Garrett today on the Dr. Oz show, and it made me miss some of the people that we treated on that show. Yeah, and I think we should do it again because there are a lot of people that need help, but we'll see. We may have some version of it going forward. How do I feel about medical marijuana? I have no problem with medical marijuana, Connie. I just have a problem with it as a political maneuver to try to get marijuana legalized. Because when people bring in medical marijuana to a state as a stepping stone to legalization, the practice of medicine around the medical marijuana is terrible. As was it Seth Rogen said, he went in there and they said, why are you here? And he said, I have a marijuana deficiency. It's honest. And what'd they give him? Marijuana for his marijuana deficiency. So my husband taken hydroxychloroquine for 7 years. It's crazy how friends and family are reaching about this dangerous drug. That is insane, grow or forage. That is insane. I prescribed probably 1,000 doses of hydroxychloroquine, never seen one side effect. That is, and remind them that chloroquine, which is actually the more problematic version of this, is available over the counter in most countries that have malaria. Over the counter without a prescription. It's safe enough for that. It's crazy, crazy, crazy. It's just unbelievable. As somebody who just learned how to pronounce hydroxychloroquine has an opinion about it, as opposed to those of us who have been prescribing it for 35 years. And I will say this the third time today. I just completed a continuing medical education exam which recommended hydroxychloroquine as first line for lupus, first line for rheumatoid arthritis, and that it should be continued during pregnancy. There's almost no medicine I can think of. There are very few that they recommend continuing. It's safe enough that it can be continued during pregnancy. That blew my mind when I saw that. I did not know that. FDA, Remind yourself, the FDA does not have anything to do with physician practice. The FDA tells the drug companies what and how they can bring things to market based on the research that the drug company invests in to present to the FDA. What we do as physicians is completely up to us. 20% of prescribing is so-called off-label, meaning the FDA does not approve it. And about probably 5% of prescribing has never been presented to the FDA. There's things like digoxin and a thyroid replacement. It came into being before the FDA came into existence, and we've been prescribing those things forever. And it turns out digoxin's not a good thing. Took us 40 years to figure that out, but we eventually do. But it's been prescribed a lot in the meantime. Well, it's not as good as some of the other things we could be doing. Let's put it that way. Okay, I want to wrap things up. Can hydroxychloroquine work for ankylosing spondylitis? Sinlu, I think it's more for the crossover syndrome. So if you have AS, ankylosing spondylitis, and you have features of Reiter's syndrome or other crossover phenomena, I think then it can have more utility. What do I think about day programs for severe adults with disabilities? Should they open? The problem I'm having right now everywhere is getting care for adults that are disabled and in trouble, so as with kids. Brian, hydroxychloroquine is still proven to be prophylactic. No, I don't think. Brian, generally the prophylactic use of hydroxychloroquine has sort of been shot down, I'd say. Yes, we will talk on the 20th. Andrew and Dr. Patterson will be here to, quote, blow you all away, according to Andrew. They really have a lot of distrust in the government. I found the mask makes when the public around people where you can't social. That's true. That's true. Good for you, Robert, for doing your own research. That's exactly right. And the aerosol research, don't pay attention to that because there's no evidence that aerosols cause transmission. Zero evidence of that, just far. Breast implant illness, yes, it does exist. There is such a thing. It's rare. It's rarer than we thought, but it does exist. Let's see. I'm trying to keep up with you guys. Should gyms be closed? Brian, not in my opinion. I think they should be wear a mask and you limit the number of people that are in there and you should washing things down carefully. Susan, did you put something up there? They're saying thank you to you. Back on oral mesalamine and Roasa for your inflammatory bowel disease, I guess. I lost track of you. Yeah, your ulcerative colitis. No, I'm not going to answer an operatic voice. Sorry about that. Does COVID cause neuropathy? COVID causes a lot of neurological issues. It can even cause a Guillain-Barré type syndrome. The 1918 flu, one of the biggest problems with 1918 flu, other than its fatality rate, was it caused a post-viral syndrome, which this one is causing too. Any severe virus can do this. And they called it neurasthenia back then. It caused psychotic illness, depressive illnesses. They saw tons of psychiatric pathology from the 1918 influenza outbreak. We are seeing that here too, and they're called the long haulers now. And there is some evidence, they're coming up with some treatments for that too that may help the long haulers. So that'll be interesting. Maybe we'll talk to Dr. Patterson about that when he comes in.
We're not doing Tuesday. Monday and Tuesday we're not doing.
Oh, Monday and Tuesday we will not be doing a show. We'll be here tomorrow and Sunday.
Monday, Tuesday we're going to be.
Yeah, Sunday, Monday, Tuesday will be away, but we'll be here tomorrow.
So no Doc Talk Tuesday.
No Doc Talk Tuesday, that's
It'll
right.
be
Nancy,
Doc Talk
Hashimoto's does not make you more susceptible to COVID. No, Hashimoto's is so common. It's like arthritis. It's that common, and it's a nothing. You just take the replacement therapies. All right, we're going to wrap things up here. We appreciate you guys coming on in. We'll be here tomorrow.
Go out with Dr.
Maddie, ketamine for depression is excellent in resistant recalcitrant depressions who failed other treatments. What's that, Susan?
We're going to go out with your wake.
Okay, they're going to go show you.
Don't
Susan,
forget about.
Susan's dying to show you my wake board again. And don't forget tonight's special report, me and Alex Michelson. That's at 7 o'clock Pacific time. Go to foxla.com/live to see us. Kelly wants me to go back on Howard Stern. I've been communicating with Marianne from Brooklyn a bit and Gary a bit. So Kelly, your dream may come true at some day in the not too distant future.
All right.
Thank you guys. Julie, thank you for acknowledging my honesty. I just try to be honest and straightforward and call things like I see them based on the available knowledge at the moment.
So Teen Mom's coming back.
Teen Mom is coming back?
So you can go back on that too.
I don't know what you mean.
Teen Mom is coming back again.
Somebody said. The reunion? Oh yeah, I think Teen Mom 2 is about to come back.
The
reunions I think will happen eventually, so we'll see that.
After New Year, after Labor Day, we'll know.
Okay, all right, we got to wrap this up. Susan wants to share with you again my embarrassing. It was my first time on a wakeboard. First time.
Amazing.
First time up and first time ever on a wakeboard. So here it goes. Have a good day.
You got to wait for it.
Ha ha ha!